Hi everyone, my name is Maroof Khan and I am part of Community Engagement and Involvement team at the NIHR Global Health Research Center for Non-Communicable Diseases and Environmental Change. Um, and it's a pleasure to welcome you all today as part of this session. This is the fifth session of the Voices of Practice. And Voices of Practice is a series co-created with our Public Advisory Board, where we come together to reflect, learn, and explore what meaningful community engagement looks like in practice. And today's session is titled From Grassroots to Global, and the theme we will be exploring is how youth-led community action shapes climate and policy change. We are truly excited to have with us Mr. Sohanur Rahman. Sohanur is a climate justice advocate and youth leader from Bangladesh, currently serving as the executive coordinator of YouthNet Global. His work focuses on climate resilience, locally led adaptation, and just transitions, amplifying the voices of communities most vulnerable to climate change. What makes his work particularly powerful is how he bridges grassroots realities with global platforms, actively contributing to international climate processes, including multiple UN climate summits. He also serves as the country youth coordinator for the Scaling Up Nutrition Civil Society Alliance in Bangladesh, supporting stronger youth participation in governance. In today's session, Sohanur will share insights from his experience of mobilizing young people, building movements, and influencing policy spaces from local context to global forums. He will help us reflect on what it really takes for community and youth voices to move from margins to the center of decision making, and how that influence can be meaningful and lasting. Before we begin, just a quick note on the format. So Sohanur will speak for around 30 to 35 minutes, and after which we will open the floor for 15 to 20 minutes of questions and answers. I would encourage everyone to keep sharing your questions in the chat as the session progresses, or be ready with them once we open the discussion. So without further ado, um, please join me in welcoming Mr. Sohanur Rahman. Over to you, Sohanur Bhai. Thank you.
Yes, thank you, Maruf Bhai, and it's a great honor and pleasure. And when I got the news that I am selected for the Public Advisory Board for this great initiative, I was wonder, so who nominated me or how I got the chance to contribute in this great project, especially in Bangladesh, especially, the NCD and the environmental issues. So I am not a health professional. I am a youth activist, and then turn to the young leadership of the country. So obviously it's a great opportunity to share what we are doing in Bangladesh, especially uh, through the youth leadership. So today I'm sharing about what the Marubi already said. So the show people are working to strengthen nutrition and climate resilience. So it's from amplifying the grassroots voice, but influencing national policies and the global discussion about health, climate, and nutrition. So that some findings or some methodologies I am sharing that based on National Consolidated Nutrition Dialogue Report, what our team is led. So what program I am sharing here, it's a part of the global scaling up nutrition movement. It's a UN movement, but we are part of the civil society movement, and civil society movement has a youth program or youth wing. So in Bangladesh, Save the Children Bangladesh was secretariat for this initiative. So our aim was to mobilize youth from diverse region of Bangladesh and background to engage policy dialogue, support local nutrition initiative, alleviate community voice. And the prime and most focus was that program is hearing the unheard voice, who are from the grassroots, who are the climate vulnerable, and who are bearing the burden of the climate and environmental crisis. That was the main motto of this program. And Bangladesh, coastal delta country and urban poor communities face climate shocks, food prices increasing, limited access to safe water, sanitation, and health services, and youth are disproportionately affected by, affected, but not only affected, women and youth, they are also playing central role for food and nutrition security. And due to climate crisis, the salinity is increasing as a slow onset event. So now waterborne disease are increasing in Bangladesh. And if you ask someone what the main or top one priorities for climate action, that is water. Water everywhere, but not a drop to drink in coastal and Barin region. So the method of this program was to organize a train of the facilitator of selected youth leaders from different parts of the country, because while we will work with the community, especially most marginalized community, we have to follow some protocol, how we will hear them with dignity, how we will safeguard them, and how we will treat them is as part of the documentation or recording their voice or their priorities. So we provide a national level train of the facilitator to youth leaders. Then it was a fully youth-led program from project coordinator to the implementer. All are youth and youth volunteer. So then that trained youth volunteer, they hosted 12 community dialogue. It's called nutrition dialogue in 4 districts. So 3 in 2 coastal division, one obviously Satkira, where our project ICDR village project is running. One is Satkira, especially Shamnagar. Another is in Khulna. Another district is Borishal, and last one is the north part of Bangladesh, is a Kurigram, is a river erosion prone and flood prone area. And through these dialogue, we engaged 270 participants, and 73% were women. And we also targeted some most left group, like historically excluded, like one community in Borishal, that's Manta floating fisher folk. And that Manta floating fisher folk on whole life, they lives on boat, they born in boat, and they die in boat. Second one is a horizon family. They're the sanitation worker. They're the low caste, and in Indian subcontinent, horizon are a socially excluded community, as well as the Munda indigenous community and the coastal belt, especially nearby the Sundarbans. One new community arise, that's tiger widows. So human and tiger conflict are increasing, but the stigma goes to the women because you are the reason for these fatalities, or you are the not good women or unfortunate women. Even slum dwellers, because not only rural, also urban areas, and especially climate migrant people, they are also facing these health and nutrition issues, and flood affected farmers. That was our target group. So some pictures from the participatory youth facilitators training, and it was facilitated by youth organization and the nutrition experts, like who are working on nutrition, like Save the Children or Care Bangladesh. They facilitate some technical issues, but YouthNet, my organization, facilitated some participatory engagement, and how the nutrition is a youth issue and why youth should advocate for this. So that was our foundational work through the facilitator training in Dhaka. And most of the participants from 4 districts, in 3 is coastal, 1 is northern Bangladesh. So that's the geography. So I mentioned 3 in coastal, Burishal, Khulna, Satkira, and 1 is northern, is Kurigram. So the exciting part is a community dialogue. So it's not a fancy dialogue. It's a like the courtier meeting, but it's a community-led dialogue. Our young people, youth leader, they facilitate, and they heard what challenges they are facing due to the climate shocks, but it's focusing on the food availability, affordability, accessibility in their community. So one photo is in Kurigram with farmers group. Another is a Manta fisher, floating fisher folk who lives their whole life in boat and historically excluded from the mainstream. And another one is a Khulna, is a flood affected communities. And last one with Shatkira with the tiger, Munda indigenous communities. So that 12 community dialogues, nutrition dialogue held in 3 districts. And we got some findings. That one findings is of food insecurity arising due to high food price and reduced protein intake, especially who are the indigenous, they're losing their historical or traditional food habit. It's also linked with the nutrition. Flood, salinity, erosion decreasing, especially fish cases, especially who are the fisher folk, they're not getting hilsha or other fishes due to salinity. They lose their livelihoods as well as their, the protein sources. And unsafe water for the pollution or the salinity and poor sanitation increasing health risks and non-communicable diseases. Women face waste gap, stigma, and restricted decision making in the community. Limited institutional support in slums who are in informal settlement and moving river moving sandbars like chore areas. That key findings we found in the youth-led nutrition dialogue. And not only the vulnerability, we also got some, the best practices or coping strategies or leadership what the youth and women are doing, like homestead and rooftop gardening in this area. Women and youth skills training and diversified livelihood options are increasing. Community-led water filtration initiative in some area and as well as rainwater harvesting. Youth-led nutrition education in schools and courtyard, micro savings and cooperative model emerging. So that's some good practices we found through the nutrition dialogue. And also policy implication. So nutrition insecurity is sometimes excluded from the climate policies, and sometimes health is a broader agenda missing from our national policies like national adaptation plan. So this nutrition dialogue also pushes for more integrated nutrition, livelihood, and social protection to be long-term resilience through the national policies. And what the policy option we found, nutrition sensitive climate action, economic empowerment for the resilience, economic resilience, strengthening local food system and governance, sometimes market linkage, because in chore area it's most fertile after the flood, but issue is a exclusion or the market linkage. Community-based nutrition education, improve wash and health facilities, mobilizing climate finance for nutrition resilience, and through the local plan, local budgeting that we found in policy option. And after that, we convene a national dialogue in Dhaka, and we invite all the grassroots champion who conducted these 12 nutrition dialogue. And we hosted, first one is a youth panel. And firstly, I shared the findings, and then it was a lively and interactive panels, and the local youth leaders share what they observed, what they found during the local dialogues in the community, the nutrition dialogues. And in these national dialogue, we included government, non-government, academia, business, and UN and donor, because Sun has different, and it's very organized, like not only Sun civil society, Sun government, Sun business, Sun UN, Sun academia. So it was multi-sectoral approach because we need everyone, and youth is a cross-cutting issue for all the things. So the second one was the multi-sectoral platform, mobilizing all the stakeholder, and we cascade or we shared our findings to them because we found something. But if it's not implication or moving forward, so it will be the waste of time, waste of money. So how we can continue these findings to the national policy making through some enablers or through some actors. So that was our approach. So last one is a national advocacy. So through this initiative, we got invitation from Health Ministry to be part of the national Sun coordination. So now in any Sun coordination meeting, they invite us to represent our constituency. That's the one thing. Second thing, in last year, the Nutrition for Growth Summit. So before EV of the Nutrition for Growth Summit, so we had some bilateral meeting with the French Embassy, local French Embassy, as how we can continue this initiative. And after the COP30, we hosted a debrief, and I presented what the key outcomes from the global negotiation of COP30 in Blaine. And the government, especially the additional secretary or Sun focal point, they got the update from this initiative. So it's not only local or national, we also shared these findings in global forum, like Sun CSN Asia Regional Forum in Indonesia. So we had a huge visa barrier, but we shared our findings through online mode, what today we are running, as well as the youth retreat in Nairobi, Kenya, Nutrition for Growth Summit in Paris. So on that forum, we shared our findings from the nutrition dialogues. And as well as the COP, because my experience or YouthNet experience, we attended last 5 consecutive COPs from COP21 to COP30. And since COP28 in Dubai, so we collaborate with the UN Sun movement, and we shared with these findings with the Sun Global Focal, and as well as COP29 in Azerbaijan, Baku, and latest one is COP30. So in ASEAN Pavilion, they hosted us, and we shared our ground realities and what can be the global implication, especially for in terms of adaptation financing or the others issues. And currently I'm serving as a young negotiator for Bangladesh for adaptation, just transition and gender. So I try to health and nutrition integrated action for our country. And the ground evidence is the sometimes it's the nutrition dialogues findings what we found. So through this program, Youth for Nutrition, we got some, we have some recommendation from our youth team, that is they include nutrition in local climate plans while we develop local adaptation plans or disaster plans. Agriculture, support saline tolerant crops, rooftop, sack gardening, aquaculture. Youth engagement, fund youth-led in nutrition clubs and campaigns. Everyone is talking about youth, but no funding for youth-led initiative. And we are facing huge systematic barrier through government, through NGOs, and through system. Women-led livelihoods, established micro loan fund and cooperative centers for women, water and sanitation, expand arsenic mitigation and drainage system, as well as the salinity issues. Food price monitoring, because due to inflation and many issues, the food price is hiking. So enforce market inspection and food safety, and young people also can be part of this monitoring. And obviously climate finance, support nutrition sensitive adaptation initiative. And Bangladesh marginalized communities show a strong commitment to resilience, but how we can support them for hunger-free, equitable, and climate resilient Bangladesh. So that is our recommendation from the program. But now I am sharing some best practices or community engagement. It's beyond the nutrition program of YouthNet, but it's some YouthNet core program. So last 1 decade, we work with the Manta Fisher folk, what I mentioned. So recently we started a project named Manta Connect, supported by Asia Foundation. So it has 3 components. One component is health. So previously we worked with the in-person community health camps, but now we are leveraging the technology like the telemedicine. So we build a partnership with the Bangladeshi renowned doc time telemedicine platform. So now our youth volunteer are giving the telemedicine support to the local Manta fisher folk who are excluded from the mainland. So, and not only services like telemedicine or e-education or the financial literacy, we also supporting them to build agency. And they are, left from the birth registration. They are excluded from the national, the identities. So that's why they are out of all kind of support from government, non-government. So the number is 5,000, these fisher folk families in Borishal division in Bangladesh. but 100 or maximum 200 people now get the voter rights, but most of the people are out of the citizenship. So recently we support them to mobilize them through local Manta committee, and that was like a festive voting, and they choose their leader through the voting. So and that we are doing in for uplifting their rights. And so the health is not charity, health is right, so how they can claim and they can get. And previous government or the NGO sometimes thinks it's a gypsy or bede who are the like snake charmer, but they're not the snake charmer, they're the unique community who are fully dependent on river and fishing. And due to climate change and natural disaster, they are leaving their centuries long heritage living boat. So that's the one thing we are doing. Second one is supporting the chor. Chor is a rivers moving island or river bed in Kurigram. So we owned that chor in 2022 to responding Kurigram flood. So after that, we had a build relationship with them, not as a traditional NGO, but the youth group. So then we are continuing adaptation support to them, or through our advocacy, the Water Development Board deployed 30,000 sandbags to protect the community. And we also gave some small enterprise support, entrepreneurial support for shop or livelihoods. So, and we also closely work with the children, that some art therapy for children or the adaptation planning. You are viewing this slide. So that also youth-led engagement for the chore people in Kurigram. And latest last not the least, that the tiger widows. So I mentioned that the conflict between human and the tiger increasing in nearby Sundarban area in Bangladesh and area of the India, West Bengal. So these women, they are bearing this stigma for many years, why they lost their husband, and they're excluded from the social, services. And so we work with tiger widows as well as men and boys, how we can defeat this stigma in this area. So we had a project with British Council that named Tiger Widows to capturing their voice and present this voice in partnering with another theater in Manchester, Ergon Theater, to sharing with the British and Bangladeshi community and building the diaspora connection and award the British people what the someone burned coal in Manchester, but how the climate crisis impacting women's, especially tiger widows, as well as the reproductive health issues are increasing in the Sundarban coast. So that was one youth-led initiative, the tiger widows. And YouthNet started as a advocacy group or campaign group. We are not charity or a relief group, but frequent disaster, especially since 22 flood in Sylhet or the embankment collapse in Satkira. So young people are actively participate the flood response, and it's also featured in different UN platform and ZNDR, Global Network on Disaster Risk Reduction, or mangrove restoration in the Sundarban area that young people are doing. Yeah. So thank you. This is my presentation. I am looking forward more questions from you to share more things, especially challenges or other things. Yeah. Thank you. Over to Marub bhai.
So please feel free to unmute to ask any questions that you may have, or you can put them in the chat. While others are thinking, I at least have three questions, Sohanur bhai, for you. So I don't see any questions at the moment. Also, I let Noor Sanauddin has raised his hand. Noor is from one of the others other NHR center based in Pakistan and Afghanistan, the Center for Impact. Noor, please feel free to.
Thank you very much. It was a very good presentation, Sohanur. I really appreciate, especially at this young age, you are taking a lot of leadership, and this is really commendable. So, because this is a community engagement session, and I'm interested in understanding what were the different issues that you faced while mobilizing communities, because sometimes communities are not willing to come forward So what were some of the problems that you faced, and then how you use certain mobilization techniques through which you were able to secure the support of the people?
Yes, thank you, Nurbhai, for your
So,
direct.
Anurbai,
Yeah.
before you respond to this question, so one of my questions is slightly related to that.
Hmm.
So I'll ask that
Yeah.
as well. What I wanted to, on the same lines, understand is that from your work in mobilizing and working particularly with the young people, so what would you identify as the most significant challenge in sustaining youth engagement, be it related to climate action or any other work? And additionally, how have you addressed these challenges to build momentum and maintain this meaningful participation over time, particularly with the youth?
Yeah. Thank you. I first response to Nurbhai. So sometimes the problem is the traditional mindset, and that traditional mindset created by us means the traditional NGOs and the research institute. So while all of the researchers or the NGOs are going to the same community and repeatedly asking, what is your problem, what is your problem, what is your problem, so then they set some mindset or some answers to them. While they know you are from the NHR, so they know what to tell you, and they try to understand the jargon or the keyword. So they know it's NCD, so they will respond you all related to NCD. So that is the one typical mindset from them. Second one, they want solution or support, but who are the journalists or the research group, they can't support immediately. They develop some report, some evidence, then its impact to the policy, and then get support. So sometimes the community people are frustrated because lot of people are taking photos, getting taking interviews, but scenario is not changing. So you are grabbing data, extracting data, but they are not getting immediate solution. That's the second thing. Third thing is a beneficiary. Like while a NGO arrive the community, they treat them community people are the beneficiary, and they do some typical committee. So while project gone, committee gone, all impact gone, washed away. So it's important to treat people as a partner of your project or your initiative. It's very beginning. And the project should be co-create, not imposed. But most of the traditional projects are imposed from Dhaka or Delhi or London or Washington, not from the community. And the project development mechanism also same thing. While you win the project, you set up your office, then you win the community for selecting the beneficiaries. So that's why it's very beginning, you are not treating them as a owner of this project. So the ownership, the issues. But what we found, like while we work with the beneficiary, not beneficiary, the community partner, so they found us as a youth, we are their family member, their niece, their son, their daughter. So that relationship we build, so that's why our relationship is not the recipient or the donor. Our relationship with them as a co-creator or the partner or the co-supporter, and with them empathy and dignity lens. So that's why our Kurigram program in Chor YouthNet or the Mantha community, so we are getting up to date information from them as a family member or as a community. So that relationship is important. And we also found some lack of coordination. Nurbhai, you are, or Maruf Bhai or me, we all are working in same village, but we are not collaborating because your project is different with different donor. Maruf Bhai's project is different donor. My project is with different donor. So it's not collaborating, but sometimes it's conflicting because I am doing most. Why Sohanur working there? And youth movement sometimes, they are not getting big budget. They are using a small budget with the huge impact. So traditional NGOs are saying you are our enemy because you are doing something impactful with very small budget. That budget equal to my one staff or one employer. So that conflict sometimes creating with the youth movement and traditional local NGOs. Last one, Maruk bhai, for the youth sustainability, one issue is a knowledge leadership. especially while we want to work on climate change or health issues. So climate action is not only tree plantation or the plastic collection, it's also system thinking. Why the climate crisis, occurred, what the solution for climate crisis, what we can do for the local communities. So sometimes it's getting trendy, like in Bangladesh, while the AIDS program started in early 2000, everyone is working for AIDS. But while Global Fund stopped, now no one is working for AIDS. So now the community are suffering, but no one responds to them. So now climate change also same thing. Everyone is working on climate change, but what part, what contribution, or everyone is working on climate justice. What is climate justice and what is injustice? What is health justice? What is injustice? What is reproductive justice and what is injustice? So that system thinking also important for young people. So if young people can build their knowledge leadership, so most of the claim from us that we are excluded from decision making. So only including young people, community people, or sending some women in the COP is not true women engagement. Our first thing should be empower them how they can contribute on that process. And while we can establish that they can contribute, then government will open their door. And last one is a trust building, because we have huge mistrust between generation, between government, non-government, and even youth. So while government can trust youth, youth can trust government, then we can something do. Our roles also challenging government while they are doing some bad thing, but it's not all time challenging government like the opposition party. So that trust building also important, Maruf bhai. Thank you.
Thanks, Sohanur bhai. I think this is really, I mean, the kind of light you are focusing on, the trust that we need to build, and then also the role that different funding that you get that plays. Really, really interesting and really inspired to hear from your experience, the kind of clarity that you bring in to the thinking. Um, there is another question from Prachi Agrawal in the chat. I'll just read it out. So she's saying, thank you for the great insights and presentation, touching upon involving the community as equal partners in climate and health related community engagement. But what are the best ways to build a shared language between external partners and community individuals as a first step to help both sides understand each other's contexts fully?
Yes, thank you. So I want to talk about language. I don't know I can fully touch on that shared language or not. So for the climate issues or sometimes health issue, the language barrier, the one of the big one. And for climate crisis, so climate change is a scientific and proven, thing. It's not someone idea. So it's a fully science backed. That's why we hear the science and scientists, we follow the IPCC's report, but it's also lived experience of the people. It's also traditional knowledge, indigenous knowledge, local knowledge. But what the problem with the community, I think it's not problem, but challenge, that community don't understand our language, like adaptation, mitigation, just transition, loss and damage, NCD, SAM, MAM. So we are making more, abbreviation, NAB, GAP. So NDC 3.0. So that's the one challenge to the community, because it's more jargon and sometimes it's difficult to localize in some, like adaptation in Bengali, it's Obhijojon. So sometimes it's more difficult rather than English, or mitigation, proshomon. So it's sometimes more difficult to English, or gender transformation, gender rupantar. So that's the language challenges, as well as how we can amplify the grassroots language to the global negotiation, because global negotiation is more technical and then there no room to hear a story in the negotiation. They need the technical input. So at YouthNet, we are the bridging the community, the local language, to translating to the negotiation text through the country position paper or the negotiation position paper. We are also doing vice versa, translating the global negotiation or global text to the local language. through the local method, local media. Sometimes we use community media and sometimes social media. So that we are doing. So, and the common understand or common language sometimes is important for local issues. So how much jargon or technical word we use in the community, they will not understand, as well as all community perspective will not be science backed. Sometimes it can be me, sometimes it can be false solution or wrong method. So that's role we have to check and balance between science and lived experience. Thank you.
Thanks, Sohanur Bhai. So there is another question from Jason. He's asking, of all the community-led initiatives you mentioned, which one has been the most successful so far, and what made it work from your experience?
So what I am sharing about the nutrition dialogue, it's some 12 dialogues, and we am amplifying that voice from grassroots to policy making, but it's not fully successful. The dialogue successful, national dialogue successful, we convey this message to the national or global forum. So that's the successful model. But while the initiative is successful, the people or community getting more support for nutrition or nutrition resilience. But I shared some initiative from YouthNet that beyond the nutrition program, like the Manta Connect or the Tiger Widows or the Chor. So most successful one is the Manta Connect over the river dependent community, because now we successfully providing them the telemedicine support. So who has no mobile phone, but our young volunteers, they supporting the community through their mobile phones every day. They are getting the e-prescription and getting the support from the medicine who were excluded from the whole health system, as well as they are getting education and the financial literacy. So that's why we found that the Manta Connect and also local leadership, like we build Manta committee, Manta steering committee through a election, festive election. And also we engage local host community or local leadership, journalists, academicians, politicians, government through Manta advisory committee to support the Manta fisher folk groups. So that is doing great with multi-sectoral coordination, but as well as the Chor Island in Kurigram. So how they are rebuilding their house from erosion and agroecology initiatives or protection from the river erosion, especially women leadership. So that's very inspiring for us. And I raised in Porishal coastal region, but it was great experience to work in northern Bengal. That the another geography. Yeah, thank you.
Thank you. There is another question from Medhavi. She's saying, thanks for your honest feedback on how we can do better with communities. One thing we have struggled with is community beliefs or approaches going against ethical guidelines. For example, if a community doesn't want us to engage with women or develop employment opportunities for them, or if we see an incidence of child marriage, and if we report it, it will break the relationship with the community. How do you handle when ethics versus value clash?
It depends on trust. So for photography, for data collection, ethics is a mandatory for us, or safeguarding is mandatory for us, especially ethics. But sometimes we need their photos. And while they will give consent, they understand that you will use this photo, this data for their better development or better improvement. You will not sell the data, you will not sell the photo, or you will not capitalize. So sometimes people think who are development worker, they are stealing their information, photos, and they are making money for their own purpose. It's not impacting their lives. So that's the myth or belief of them. But it's obviously the trust. And when they will understand that these will be useful for their improvement, then they will allow. And for the child marriage, in my activism life, I spent many years for child marriage. especially part of the global Girls Not Bride movement. So normally we are focusing on symptom. For climate change, we are focusing on symptom, but we are not focusing on root cause. So in Chor YouthNet, the mothers ask me, Sohan, what the solution for us? We have no school after 5th grade. We have only primary school. So we have to send them for high school in another island. We need cost of money. We are not interested to marry, forced to marriage, but we have no way. So sometimes we are not addressing the main driver of the child marriage. So it's very easy to stop child marriage. And as a community organization, our many like-minded organization, they stop child marriage immediately, but then it's remarriage in another area. So that's why we have to more focus on the root cause or drivers of the child marriage. So if we can address that education gap or the, the health issues, or the education is one of the main issues, or education cost, so then we can address these child marriage issues in the community. And what I want to share one conflicting issues, Maruk Bhai, for the Manta community. So Manta people who are the fisher folk, they live their whole life in the boat. But nowadays, due to natural disaster, not natural disaster, climate disaster, they are not continue their traditional life in boat. So now they are very interested and crazy to move to land, and they are asking the khas land or government land. And government has policy, khas land management or the government land management. But what we are afraid of, we mean YouthNet or local journalist, that is the heritage loss. That's also, name non-economic loss and damage. While they will move to land, it's 100 years, centuries, the traditional living practice will be gone. And due to climate crisis in 2050, our millions people will be climate displaced or refugee. So we should start the floating life from mainland people right now. But now they are moving, they try to move to land. So while the journalists are talking about the indigenous, the heritage, the cultural heritage, so the community people found that journalist as an enemy of them. But we are trying to balance their immediate support as well as protecting their. So the Manta people, they value their today's income, today's fishing, because they have no, financial literacy. Even they do not count number. They don't know sometimes digit, but they are fisher folk. So we are balancing with this and slowly pushing their cultural heritage issues, because cultural heritage issue is not their concern, but it's also better, their interest of them to protecting the cultural heritage. Yeah. Thank you, Marupai.
Thank you. Another question from Ridwana is, while you are mentioning multi-sectoral coordination, how are you bringing everyone under one umbrella and ensuring sustainability of continued initiatives? And I also have a slightly related question when you mentioned that you have been invited by the Health Ministry. Um, do you face any challenges, which I have sort of seen, particularly in our context in India, when there is change in government? So you end up doing everything from the scratch because the new government might have different set of agendas, and then the previous work that has been done with them sorts of get lost. So you start building that relationship again with them. So yeah.
Yeah, thank you, Maruf Bhai. So one is the collaboration. So one thing is, while we will work in some community or some district or some region, we should do the mapping, who are doing what. So then it's treated as an initiative, not a typical project. Typical project means it's my business. I will deliver, I will get salary, and then success report. But while it's a initiative, then everyone will collaborate. It's not someone's project, someone's individual project. It's a collaborative project. So not the silo approach. And while And based on our campaign and advocacy, now many organizations in Borishal, they are working with Manta community and with different aspect, and they are doing different, study. But Marubhai, you are doing one study, Nurbhai doing another study for the same community. I am doing another study. But while we are not coordinating or not sharing each other, so sometimes it's a duplication. Sometimes it's a waste of money, waste of time. So that's why we invite all the organization in the same under the same umbrella, and say it's not our individual initiative, it's our common initiative for the best interest of the community. And they said, yes, we want to support these people under this initiative. So so like same thing like public advisory board. So we formed the Manta advisory board with all NGOs, all different stakeholders, including journalists. So on that advisory committee, we are collaborating each other. And while all the NGOs, civil societies are united, government also getting one voice. Otherwise fragmented, like the elephant story. Someone said Manta is a tail, someone is Manta is a hand, someone Manta is a pillar. But while we are coordinated, so we are giving the same messages to the government, like environment ministry or the fisheries livestock or the health. So that's why that compromising or the collaborating initiative is important rather than the competition. Sometimes healthy competition is good, but we are not competing each other, but we want to serve our community. Last one for the health ministry issue, Maruk Bhai. So while the government is changing, the officials also changed. Political ideology also changed. Even, we faced, and you understand that our political scenario after the uprising in 2024, then the civil society led government established. But due to this uprising, we expected, more justice in health, more, reformation in health sector, but still we are paying price. Like while the civil society government established, so in Bangladesh, the vaccination is only one vendor, that is UNICEF. So government thought, why only one single or monopoly? So they try to engage more, competitive method or involve the more the vendors for the vaccination. But finally it takes a delay or made delay, and that's why thousands of children killed, the lack of the immunization. And government also stopped the health sector program. And sometimes nepotism. So the interim government choose someone, she's not from the health sector. Even her health was so bad, so she spent her whole time to recover her health issues. So that consequences we are still facing. So but new government started, and they try to recover about that immunization, health and nutrition issues. But for climate sector, while the new government arrived, so they reach out to me, because they do the mapping, who are the active voice or who has knowledge leadership. So my experience with the climate issue in Bangladesh, so government change will not problem, but sometimes the political linkage. Maruf bhai, like I worked with the ousted government, then worked the interim government. Now I work with the current government. So sometimes people want to tag that Sohan is from previous government, but I am not the government linked. I am the public or advocating for the most affected peoples, and I have to work with the government who make the policy. So that's my stand, and what when I clear them, so people understand my position. Nurbhai.
Yeah, I just want to share something similar. We are working in Pakistan. Uh, this multi-sectoral coordination, we call it coalition for health, coalition, because we try to, bring together all those relevant stakeholders who are working for health, for promotion of health, including the health department, education, the school system, the private sector, the NGOs, and the common people who are interested in a particular health issue. So far we have conducted one meeting of the coalition, and that is very, very successful. We are very satisfied because a lot of organizations and stakeholders came forward voluntarily to support what we are doing in the particular district. So I believe this is a good strategy, and I don't know exactly about the sustainability issue because we are not yet at that stage. But the first meeting was very successful in our case. Thank you.
Maruf bhai, thank you, Nur bhai. Maruf bhai, I want to address that two issues. I think one is sustainability of continued initiative. I think I respond Ridwan Apa of ICDRB. So for Torikul bhai, he asked about the private sector engagement. Maruf bhai, it's very challenging to engage private sector, and especially who are environmental defenders. So it means against the business. But we environmental defenders are not against the business. We are demanding responsible business, ethical business. So profit can't kill people. What are happening right now in the coastal belt due to salinity or density or the malnutrition. So business have huge responsibility, and climate crisis is a business issue. It's not only sole environmental or development issue. Climate crisis happened by the industrial revolution or capitalism market. So for the and you know the new development discourse created after the USA phase out of USAID or the right-wing government in the Europe. Now the development fund, climate fund are decreasing from, so it's also hampering or impacting everyone who are, especially who are working for health, gender, and climate. But we thought we found two financing pathways. One is a private, obviously private sector CSR, as well as the philanthropic foundation like Bloomberg or H&M or the Loudest Foundation. So what we are doing to onboarding the private sector on this movement, because for mitigation is a more relevant technology. So everyone, especially European countries, businesses, they are more enthusiastic of the about the mitigation. But health is part of adaptation. And adaptation is not a business case sometimes. Adaptation also has technological solution, but it's a more agency development, more empowerment related, more adapting with the climate adverse impact. So adaptation is not getting enough support. So while adaptation is get support, it will directly support to water, health, nutrition. So that's challenges we face, especially adaptation ignored. But now new area is a trade. In previous time, every embassy, while meet with another counterpart, they mentioned we talked about the climate crisis, but now they talked about the trade and green transition. So we are focusing on just transition, and just transition is not only mitigation, it's also adaptation, it's also health, it's also occupational health and safety, OSH, especially for workers or most marginalized people. So through the just transition lens, through the green transition lens, we are onboarding private sector, and we are working together. In Bangladesh, we created a alliance named Shobut Somonnoy, Green Alliance. So involving the private sector from construction, from RMG, from labor rights, from different entities. And we are developing our own common plan to address this. So it's also creating more trust, more interest. Then we can get, continue the sustainability. But challenge is government interfere, because government has some own political agendas. So they grab the CSR money for their businesses as well as sometimes sports. So in Bangladesh, most of the CSR money goes to football match or cricket match. But the most essential thing is water or health that was ignored from CSR financing. Thank you, Maruf bhai.
Thank you, Sohanur bhai. So, I don't see any more questions in the chat. I just have one last question. Maybe you have partially answered it before, but like you have been working with a gender sensitive approach. You gave the example of tiger widows as well. But have you encountered any gender-based barriers to participation or dialogue, and how have you navigated to or mitigated these to ensure inclusive and equitable engagement?
Yeah, thank you, Maruf bhai. So for gender, in its translation in Bangladesh or Pakistan, it's about women. Women empowerment means gender, but it's not only about women. It's about men, women, এবং sometimes the gender diverse group, gender diverse group. So due to cyclone or heat wave or the climate crisis, it's also impacting the hijras or transgender, or sometimes Bangladesh called third gender. Their representation, their agencies are, excluded from this kind of policy discussion. And women representation sometimes it's like they are the most vulnerable. Framing, so framing or story development or narrative should be positive way that yes, they are vulnerable, but they are also showing their leadership for disaster management, for adaptation, for just transition, or sometimes health issue. Like while we work in the Chori Utnar, we found Shahina Appa. She's a community health worker, and she is a one-stop service center for the community people about health, about pregnancy, about nutrition, even sometimes legal, community legal issues. So we try to showcase them, amplify their voice in the national and local decision making. So day by day we are changing that narrative, but as well as gender empowerment is not the lost project for men. So while we are doing the men and boys engagement, men are very happy. Yes, we waited for this initiative because women are getting huge. Even last day in Parliament, Bangladesh, one reserved seat women asking why only women or girls are getting free education, why not boy? Is discrimination to the boys. So she is in reserve seat, but she don't understand the equity perspective. So sometimes man has that understanding while we empowering women that the loose or the it's not benefit for men. So we empower men and boys as a ally, as a change agent, but not as a benefit, not as a active agent, but gender equality also benefiting for men. While we achieve the gender equality, it's also impact Sohan, it's also impact Marubbai. And we also get some extra privileges as a man. So we also communicating or empowering men and boys differently to not only support, also getting benefit of this program. Yeah. Thank you, Marubbai.
Thank you, Sohanur Bhai. So I don't see any more questions in the chat. Rajalakshmi is saying that such rich insights connecting the ground realities to top level strategies and jargons. Thanks for sharing these, Sohanur. We've benefited a lot. So we are almost on time. So thank you so much, Sohanur Bhai, for sharing such powerful insights and experiences with us today. That was truly inspiring and gave us a lot to reflect on, especially around how grassroots action can meaningfully influence policy and systems. And thank you to everyone who joined and engaged with the session so meaningfully. And as always, Voices of Practice is really about learning together. And today's session reminded us how community and youth voices can shape change when they are meaningfully included. So we look forward to welcoming you all to the next session in the series. Until then, thank you once again and have a great day.